Good afternoon. I'll be presenting a trend of ocular chemical injuries in a tertiary care institute. Chemical injury to the eye accounts for a significant portion of ocular trauma. Ocular chemical injuries constitute around 7.7 to 18% of all ocular traumas. Chemical exposure to the eye results in trauma ranging from mild irritation to severe damage to the ocular surface and anterior segment, which can ultimately lead to permanent visual loss. The sequels of chemical injury may have significant detrimental visual and psychological effects of the affected individual. So, proper management in the acute setting as well as follow-up is crucial in limiting adverse effects of ocular tissue damage secondary to chemical injury. The aim of this study was to review the risk factors, clinical profile and management of chemical eye injuries in a tertiary care hospital. A retrospective study of patients who presented with ocular chemical injuries was done in a tertiary care hospital. Case records of patients who presented with injuries to the institute were reviewed over a 1-year period, and the data was compiled and evaluation done. The results of the study included 77 eyes of 58 patients who presented with ocular chemical injuries. Out of the 58 patients, 22% were female patients and 77% male. The average age of the patients was from 32 plus or minus 14 years of age, ranging from 5 to 62 years of age. This is the age distribution group. Major age was between 21 to 40 years of age group. Among the 58 patients, 18 patients, that is around 33%, suffered bilateral injuries, and the bilateral injuries were more in eyesight injuries compared to alkali injuries. Alkalis contributed for injuries in around 31% patients and acids in around 68% patients, and these were the different chemicals involved in the injuries. This shows a comparative analysis between different grades of the chemical injury and the visual impact presentation. The visual impact was better in lower grades of injury compared to the higher grades of injury in both acid and alkali. Out of 58 patients, 53 patients sustained accidental injury, while 5 patients was non-accidental, and 30 patients suffered injuries in workplace, while rest suffered injuries at their home. All the eyes with severe grade chemical injuries were treated with amniotic membrane transplantation in our hospital. In the present study, the mean age of presentation was 32 plus or minus 14 years, emphasizing the vulnerability of young adults. Studies by Kuckelhorn et al. And Singpi et al. Also correlate with this finding. As reported by many other authors, as well as in this study, males outnumbered females in the frequency of chemical injuries. Most common causative agent of chemical injury was hydrochloric acid among acids and calcium carbonate among alkalis in our study. And most of the cases presented with unilateral involvement, bilateral involvement was less common in our study. The prevalence of unilateral involvement was more severe in acid injury compared to alkalis. Most of the cases in the present study had lower grade of ocular injury, as they were given prompt first aid on reaching to the hospital, which decreased the ongoing process of ocular damage by removing the insulting chemical agent. So the conclusion, early presentation with good presenting visual acuity carries a good structural and visual prognosis and lesser complications. Despite advances in medical and surgical treatment modalities, the consequences of severe chemical burns can have profound consequences to the patients. For this reason, for patients presenting with chemical injuries, whether they occur in the workplace or at home, early recognition and prompt treatment by the treating physician remain the standards for maximal preservation of ocular tissue.
Thank you for your presentation. It's a good epidemiology research question. It's a retrospective, right? Retrospective analysis.
Yes,
I wonder, why did you not consider the time of injury to the time of first intervention?
Yes.
Maybe in future research,
yes,
I think that makes that plays a vital role.
Yes,
and one more highlight is 9% are non-accidental.
Yes, sir.
Probably inducing homicide type of things.
Yes, sir.
I don't know. That is quite huge also.
Yes, sir.
Yeah. The time of onset to the time of first intervention, I think you can add in future researches.
Yes, sir. Thank you, sir.
Yeah, it's. I also agree with the fact that time of injury to time of presentation as well as time of intervention should be noted, and it's a good study. Just I want to know one thing, that there are many studies in the literature that have already documented these facts, that unilateral injury and young age group, they are more affected with these accidental traumas. Good that can be in benefit of public health?
That's ma'am the same thing, that is initial management is very important ma'am. All the injuries which had lower grade of injuries, since ours is a tertiary care institute, all the patients who presented with lower grade injuries, they actually had first aid treatment given in their, at least in the local hospitals or in the first primary treating physician. So that is an important factor. So I'd say primary treatment, at least proper eye wash is important in case of all the chemical injuries.
Okay, thank you.
You included pediatric population also, no?
Yes sir.
Because mostly in pediatric population, the injuries are alkali because of tuna packets.
Yes sir, the tuna packets, yes.
So in your study, it is.
Yes sir, our study most were young adults, but there was one case with 5-year-old also sir, youngest was 5-year-old.